Hello, everyone. I'm Dr. Naomi Chapelton, and today I need to talk to you about something that I genuinely wish I didn't have to discuss, because it means that somewhere out there, someone may be unknowingly putting their heart at serious risk right now, tonight, while they sleep. Before I begin, I want you to know that what I'm about to share comes not just from medical literature and clinical experience, but from personal grief. 3 years ago, a close colleague of mine, a brilliant, otherwise healthy man in his early 50s, died in his sleep. No warning, no dramatic symptoms. His wife found him in the morning. The autopsy confirmed a massive cardiac event. And when the full picture came together, one specific habit he had every single night stood at the center of it. That habit is eating late at night, and specifically, eating heavy, high-fat, high-carbohydrate meals within 2 to 3 hours of going to bed. I know what you're thinking. Dr. Chapelton, surely this is common knowledge. Everyone knows late-night eating isn't ideal. But what most people do not understand is the specific, terrifying chain of physiological events that unfolds in your cardiovascular system when you eat a large meal and then lie down to sleep. This is not about weight gain. This is not about acid reflux. I'm talking about your heart stopping in the night. Let me walk you through exactly what happens. When you eat a large meal, especially one rich in saturated fats, refined carbohydrates, or salt, your body initiates a massive physiological response. Blood is redirected toward your digestive system. Your pancreas floods your bloodstream with insulin. Your blood pressure rises. Your heart rate increases. Your blood viscosity, how thick and sticky your blood is, goes up significantly. Under normal circumstances, when you're awake and upright, your body manages this process reasonably well. You move around, gravity assists circulation. Your muscles help pump blood back to your heart. But when you lie down and fall asleep within 1 to 2 hours of eating, everything changes. First, your blood pressure does not drop the way it should. In a healthy sleep cycle, blood pressure naturally falls during the night. This is called nocturnal dipping, and it is absolutely essential for cardiovascular recovery. Studies published in the Journal of the American Heart Association have confirmed that people who do not experience this nocturnal dip are at dramatically elevated risk of heart attack and stroke. Late-night eating disrupts this dip completely. Your cardiovascular system stays revved up, straining under elevated pressure for hours while you sleep, and you don't even know what's happening. Second, your blood becomes dangerously thick. After a high-fat meal, your bloodstream is flooded with triglycerides, fat particles that increase the viscosity of your blood and dramatically raise the likelihood of clot formation. This condition is called postprandial lipemia, and it typically peaks between 2 and 4 hours after eating. If you go to sleep while this is happening, you are sleeping with blood that is primed to clot. Combined with the slowdown in circulation that occurs during sleep, this creates a perfect storm for deep vein thrombosis, pulmonary embolism, and, most commonly, coronary artery occlusion, a heart attack in the night. Third, your autonomic nervous system goes haywire. Normally, sleep activates the parasympathetic nervous system, the rest and digest mode. But a large meal simultaneously activates the sympathetic nervous system, the fight-or-flight response. These two systems are in direct conflict. The result is cardiac arrhythmia risk. Your heart may begin firing irregularly. In young, healthy people, this may cause nothing more than palpitations. In people with any underlying vulnerability, even undiagnosed, it can trigger fatal arrhythmias, including ventricular fibrillation. This is the same mechanism behind what is sometimes called sudden nocturnal death syndrome. There is another piece to this puzzle that I don't think gets nearly enough attention: the blood sugar spike and crash cycle that occurs when you eat at night. When you consume carbohydrates, especially simple carbohydrates like bread, rice, pasta, sweets, or processed foods, before bed, your blood glucose skyrockets. Insulin floods in to bring it back down. But here's where it gets dangerous. While you sleep, your body's counter-regulatory mechanisms are slower and less efficient. Blood glucose can drop too low, a condition called nocturnal hypoglycemia. Your brain, desperate for glucose, fires off emergency stress hormones: cortisol, adrenaline, noradrenaline. These hormones jolt your cardiovascular system in the middle of the night. Your heart rate surges, your blood pressure spikes, your coronary arteries constrict. If there is any degree of arterial plaque, and after the age of 40, the majority of people have some, this constriction can trigger a complete blockage. This is why so many cardiac events happen between 2 and 6 in the morning. This is why people die in their sleep. It is not random. It is a predictable, physiological sequence of events, and it is often set in motion by a meal eaten just a few hours earlier. I want to be absolutely clear. This is not only a risk for people who are overweight, diabetic, or already diagnosed with heart disease. My colleague who died was none of those things. He was a runner. He had excellent cholesterol. He had what we call subclinical cardiovascular vulnerability, nothing that would have shown up on a routine checkup, but enough to be lethal in combination with the wrong conditions. The people most at risk include anyone over the age of 40, because arterial flexibility decreases with age, and even mild plaque accumulation raises risk exponentially. People who regularly sleep fewer than 7 hours. Sleep deprivation amplifies every single cardiovascular stressor I've described. People who eat high-sodium diets. Sodium causes water retention, raising blood volume and pressure, compounding the nocturnal hypertension caused by late eating. People who drink alcohol in the evening. Alcohol disrupts sleep architecture, suppresses the parasympathetic nervous system, and dramatically worsens postprandial triglyceride levels. People under chronic stress. Cortisol levels are already elevated, meaning the stress hormone surge I described during nocturnal hypoglycemia hits a body that is already overwhelmed. If you fall into even one of these categories, I am speaking directly to you. Please take this seriously. I want to briefly ground what I've shared in the clinical evidence, because I am not asking you to take my word alone. A landmark 2019 study in the European Heart Journal followed over 700 patients who had experienced acute myocardial infarctions and found that late evening meals, defined as eating within 2 hours of sleep, were independently associated with a more than 40% increase in the risk of another cardiac event. A 2022 meta-analysis published in Nature Communications examined data from over 100,000 individuals and found that eating the last meal after 9 p.m. was associated with a 28% increase in overall cardiovascular disease incidence, independent of total caloric intake. The effect was even more pronounced in women, for reasons that researchers are still investigating, but which appear to involve hormonal interactions with insulin signaling. A separate study from Harvard Medical School demonstrated that eating late at night raises systolic blood pressure by an average of 8 millimeters of mercury during the nighttime hours, a seemingly small number until you understand that this elevation, sustained every night for years, is equivalent to having untreated stage 1 hypertension. Sustained hypertension is one of the most powerful independent predictors of stroke and heart attack. I am not here simply to frighten you. I am here because this is preventable. These deaths are preventable, and the intervention required is not complicated or expensive. Finish your last significant meal at least 3 hours before you sleep. This is the single most impactful change you can make. 3 hours gives your blood pressure time to normalize, your blood glucose to stabilize, and your digestive system to complete the acute phase of processing. If you are genuinely hungry before bed, choose small, low glycemic options: a handful of almonds, a small amount of Greek yogurt. Avoid anything high in simple carbohydrates, saturated fat, or sodium. Monitor your blood pressure at night if you can. Inexpensive home blood pressure monitors are widely available. If your nighttime readings are consistently above 120/80, please speak to your doctor. This is a red flag. Limit or eliminate alcohol in the 3 hours before sleep. I know this is unwelcome advice for many people, but the combination of alcohol and late eating is particularly dangerous, and I would not be doing my job if I softened that message. Invest in your sleep quality. Regular sleep of 7 to 9 hours per night allows your cardiovascular system to complete its essential repair and recovery processes. Without this, every other risk factor I've described is amplified. The man who died, my colleague, my friend, was not reckless. He was not ignorant. He was simply unaware that the habit of eating a large dinner late in the evening and going to sleep shortly after was quietly, incrementally, placing his heart under a level of strain it eventually could not survive. He is not alone. Every year, tens of thousands of people die in what are classified as unexplained or sudden cardiac events during sleep. Many of them, I believe most of them, were not inevitable. They were the end result of a preventable physiological cascade that we, as a medical community, have not done nearly enough to communicate to the public. I am telling you now. Please share this with the people you love. The change is simple. The stakes are your life. I'm Dr. Naomi Chapelton. Take care of your heart, because it never takes a night off, even when you do.